Thank you. Oh, for Todd, please talk about kidney stones and how to avoid.
Oh my God.
Go for it, Todd.
If I knew how to avoid it, I would be avoiding it right now. I promise you that.
Wow.
So I don't know how to avoid it. If you have a chance to do it, don't, because they're not fun. And I don't know. I mean, they are the most painful thing that I've ever experienced. And I did the third one yesterday. And I don't enjoy them. However, I think it's just happening because I think I'm basically detoxing. I think my kidneys are just dealing with it. I did start having a little bit of an epiphany of what might be happening. I was going to ask Phil if this seems crazy or not, but I sleep on my left side, and I'm down 310 pounds from where I was 23 months ago.
Wow.
There's a lot more pressure on things that I've never felt before. Like I can push around on my abdomen and I can actually feel like pressure on my organs. I can feel pressure on muscle. And I'm wondering that if possibly being down 300 pounds of weight, I just noticed that all of a sudden when I have different pressure points now that hurt when I'm sleeping, or they get pain on them. Like my hips hurt. I feel pressure on my stomach and my rib cage and stuff when I'm sleeping that I never had before. And I'm almost wondering if I'm putting a little bit of pressure on my kidneys for the first time, moving them around a little bit and causing some stuff to break up or something, because man, right now you're right. They're full of gravel for sure.
Yeah. In fact, the first stone you passed, didn't I tell you it was probably going to be gravel?
Yeah, you did. Yeah.
Yeah. So the phenomenon here, by the way, I understand all the symptoms you're having by feeling your body different because of the way you're lying. Definitely. And that's all signs of your body getting more circulation and more health. It's not the reason for the kidney stones, but interesting theory. Most likely your kidney stones have been there. They're probably calcium oxalate. As your body's getting healthier and you're getting inflammation out, the stones begin to shrink and actually dissolve. And that's the good news. The bad news is they get small enough to pass through your ureter. And these stones are basically specks of sand, and they have to go somewhere. Todd, you want to describe what one of them looks like, since you saw one of them?
Yeah, I can't even believe it was it, but I mean, it's like it's about the size of a pencil lead, like a tiny little shave off of a number 2 pencil lead is all it is. It feels like it's a white hot ball bearing the size of a golf ball covered in shards of glass dipped in battery acid is what it feels like. But it's not.
Yeah, think of it as an asteroid the size of a grain of sand. So it's very ragged edges, but it's very, very tiny. The ureter is very, very small. Yeah. And so you have this intense contraction of the ureter trying to move that stone out. And that's what causes the pain. And you get release of substances called prostaglandins, which cause even more contraction as you're trying to, which may tighten up the ureter and make it harder for the stone. So I told Todd we use a drug called indomethacin or Indocin, and we use that to block the prostaglandins. It's kind of related to aspirin type of drug, and it's works really well for kidney stones to get the ureter relaxed a little. Once it passes from the ureter, which is a connection between the bladder and the kidney, it goes into the bladder, and then it passes through your urethra into the outside. But the urethra is about 4 times bigger than the ureter. So if it's made it into the bladder, it's going to pass through the last channel pretty easy. But they're very, very painful. And this is the price we pay for our eating for years and years and years. Lots of oxidants.
That's a fact. It feels like your kidneys and your testicles crawled into your stomach and having a fist fight, and both of them are losing at the same time. And there's something standing on your bladder and kicking you in the back while it's going on.
Oh
like,
my gosh.
It's the craziest thing.
And I always tell people it's God's revenge on guys so that we can sympathize with women in their labor.
For
Do
sure.
women not pass kidney stones? Is it just
No,
less
they
common?
get kidney stones, but a lot less frequent to see.
Gotcha.
Yeah. But
So to answer the
but-
question, don't do the standard American diet as your best bet, I guess, to avoid kidney
Too
stones.
late for that.
It's those spinach salads you ate all those years.
I bet, you know what I bet it was? You know what I was thinking about this, because I remember this is like 15 years ago, but I had to pull like 2 36-hour shifts at work. One time we had 2 emergency service calls, and one of them I had to drive across the end of the state. Yeah, I was living off of, at the time they were called these NOS energy drinks. And that was all I lived off of. And the reason why this came to mind is whatever happened to me in that period of time, I got a terrible fever and I got like hallucinating. Like my fever is making me hallucinate. When I closed my eyes, it was like I was playing a movie. But I fought through this super high fever. But what happened after that fever and all those energy drinks was I got up and I had cold sores in my mouth from this fever, like fever sores in my mouth. I got up and I was looking in the mirror, and I had made it through all this without going to the hospital, and it was pretty bad fever. And I got up and I was standing in front of the mirror, and my throat started to swell, like you could watch it getting bigger in the mirror, and it got as big as a softball. And I had to go into the emergency room because I didn't know what was going on. I had this huge bulge on my neck. And when I went in there, the ER doctor said, "You have a plugged spit gland." That's what he told me.
Spit gland.
Yeah, and he prescribed me. He said it was from the fever. He asked me if I'd had a fever. He said the fever did something, and it calciumified spit in my spit gland. So your saliva gland wasn't leaking anymore. So he prescribed me lemon drops. He said that was the cure. But I was wondering if it was from all those energy drinks, if they whatever, because they're kind of like a citrus flavor. If it, you know, I don't know if it had and it had all the energy drink calcium crap and stuff that was in them. And I drank, like 20 of them in that week to stay awake because I pulled 2 36-hour shifts. But I was wondering if it was something like that around that time. Made some deposits.
Who knows, Todd? You were so unhealthy. You're just a miracle that you're alive. So
that's a fact. If carnivore can do it for me, boys and girls,
oh my goodness,
wow.
I'm glad you're here, buddy.
I appreciate it. The odds weren't looking good for a minute.
I hope all our audience realizes how much fun we all have together.
Yeah.
Always.